We are 2 weeks or 3 weeks away from running out of the supplies we need most for our hospitals. The only way those supplies can be provided in time is through the full mobilization of the United States military. At this point, there's never been a greater no-brainer in the history of the Republic. How on earth is the finest military on earth being left on the sidelines? That's what's happening right now. And I guarantee you, go interview our generals and our brave men and women who serve in the military. Go interview the average American soldier and ask them if they stand ready to get the supplies needed to New York City and the other parts of this nation that are in such danger right now. I guarantee you 201, they would tell you that is exactly why they are part of our armed forces. And they would not only await the order, they would welcome the order. But that order has not been given by our commander-in-chief. And it is beyond comprehension. It is immoral that our president has not ordered our military to full mobilization, because this is the great threat to our nation. We have armed forces overseas who are protecting us against terrorism and foreign threats. But right now we have a domestic threat on a level we have never seen in decades. Our military is the only answer at this point. And if we expect those goods that are produced that we need for our hospitals to get there in time, there's only one organization that can guarantee that, and that is the United States military. When will President Trump give the order? That is my question. When will he give the order? Why is he hesitating? People are suffering now, and they will be suffering so much more in the month of April. And the president gives himself an A grade, and he congratulates himself, and yet he will not act in the way we need it most. This is patently unacceptable. Our military also, in addition to their extraordinary logistical capacity, our military has the ability to bring exceptional medical personnel directly to where the need is greatest. Our healthcare leadership here in the city has made clear that supplies and medical equipment are a deep concern. Physical capacity to build out an extraordinary amount of new healthcare abilities and beds is crucial. But the single most important factor is personnel. We're going to need all the people I've spoken about previously to do all they can do, but they can't do it alone. In our military are extraordinary, trained professionals used to dealing with the most difficult circumstances. And yet they are at their bases right now. All over this country, they are not at the front. The front is here in New York City. Let's be very clear. This is a different kind of war, and the front is right here in New York City. How on earth are some of the finest medical professionals in this nation who serve this nation, why have they not been activated and sent to New York City and New York State and California and Washington State, where they could be helping right now? We need them. We need everything the military can bring to bear. I've sent 2 letters this week, and I'll be sending many more trying to get action. And letters are just a way of making 100% clear what we're talking about. This letter to Secretary Alex Azar, Secretary of Health and Human Services, and Secretary Robert Wilkie, Department of Veterans Affairs. This lays out very clearly our request that the Veterans Administration facilities in this city, all available beds, all available medical personnel in our Veterans Administration facilities be activated immediately to serve in the cause of fighting the coronavirus. We know for a fact that our Veterans Administration facilities have excess capacity, and we know we're in the middle of a national crisis. I know, again, that the medical personnel in these facilities stand ready to help, but they need the order from these 2 secretaries so they can provide maximum support to New York City, and the same would be true everywhere in the country. I sent this letter to Secretary Azar of HHS delineating the supply request again, and this is one of many requests we have made, but I'm doing it very publicly. We'll put this online for everyone to see. Here are the supplies that must be provided to New York City early in April for us to ensure that our healthcare system, public and private, can bear the brunt of the coronavirus crisis and serve our people. We need 3 million N95 masks. We need 50 million surgical masks. We need 15,000 ventilators. And 25 million each of the following items of personal protective equipment, which our healthcare workers and first responders would use depending on the situation. Surgical gowns, coveralls, gloves, face masks. We need these in great numbers. They may sound like daunting numbers at first, but given the extraordinary production capacity of this country, they are very much achievable if our nation is put on a war footing and our president uses the powers he already has to coordinate and to prioritize through the private sector the production we need. That's the kind of level of production we need, those specific supplies we need to ensure that healthcare in New York City can continue on the level we need to fight this crisis. Our senator, our senior senator, Chuck Schumer, has put forth a powerful idea. He calls it a new Marshall Plan. It's a Marshall Plan for our hospitals, and I give him credit for this because he's using one of the great examples in American history, the Marshall Plan after World War II, which literally rebuilt the European continent that had been left in ruins after the war and reestablished a thriving economy. The Marshall Plan, the original Marshall Plan, made the United States the envy of the world and created tremendous gratitude for our nation all over the globe. And that was at a time where we had a lot less technology and many disadvantages just having come out of war ourselves. Senator Schumer's right. That's the right attitude. It's the right approach. A Marshall Plan for our hospitals, for the entire nation, would involve massive new investments to support state and local governments that already are doing so much to fight coronavirus and that are struggling with the challenge in so many ways, to strengthen and build out our healthcare workforce. It would involve major investments in our strategic national stockpile and our centers for disease control. And it would allow for the large-scale infrastructure we need to fight this extended war. So I want to thank Senator Schumer, and I ask all the members of the House and Senate to include Senator Schumer's plan in the upcoming legislation you pass. Now to the part of this update that I hate to give, but I need to, about the overall situation. And I will say we will attempt to give New Yorkers constant updates, including ones we wish we didn't have to give. And anyone who needs an update can go to nyc.gov/coronavirus. Anyone who needs specific information or has specific needs, of course, can also call 311. We are seeing an explosion in the number of cases here in New York City. Now, I will be clear that part of that is that we finally have more extensive testing going on. We have nowhere near the amount of testing that we should ideally have. We have nowhere near the amount of testing we should have had weeks and weeks ago to get ahead of this crisis. Nowhere near the amount of testing that a place like South Korea had, and they were able to use testing as a powerful part of a strategy to beat back the coronavirus. We're still far from where we should be, but we have a lot more testing than we used to have. And so it is natural that as you have more testing, you will see numbers grow simply because the larger reality is being captured more effectively. But this number is nonetheless very, very painful. And I'll tell you that the city of New York will be every day at 10 a.m. and again at 6 p.m. putting together our numbers and providing updates as we are ready once they are confirmed. So based on the update from 10 a.m. today, which is different from the state's update, which came from last night at midnight. So this is, again, a different number than the state, that the state had for the city. Different number because it is 10 hours difference, and this will show you how fast this crisis is growing. At this point in New York City, based on the 10 a.m. number, 3,615 confirmed cases of the coronavirus in New York City. Again, each of those a human being and a family represented. And that number has undoubtedly gone up since 10 a.m. It's a painful, distressing number. I also have to report another even more painful number. There have been 22 deaths now in New York City directly related to coronavirus. The breakout by borough. In Queens, 980 cases. In Manhattan, 976 cases. In Brooklyn, 1,030 cases. In the Bronx, 463 cases. In Staten Island, 165 cases. I'm going to go through some specific issues before I turn to Dr. Barbeau, and I'll go quick here. Unfortunately, we can report that we have the first instance of an inmate on Rikers Island testing positive. The inmate is individual in his early 30s, and thankfully at this moment, health-wise, is doing okay. Is in isolation, has been moved to our communicable disease unit on Rikers Island, part of the healthcare apparatus on Rikers Island. This inmate was in a housing unit with other inmates. All have been checked for symptoms. 8 have been identified with symptoms and moved also to isolation in the communicable disease unit. Question came up several times the last few days about those incarcerated, and if there were instances where anyone should be released because of particular health vulnerabilities and because their status put them at low risk of reoffending or being any kind of threat. At this point, this is an ongoing effort. It will keep growing as we review more cases. The cases are being reviewed by the NYPD and the Mayor's Office of Criminal Justice, and as they reach agreement on an individual case, we start the process to release them. 40 inmates have been put on the list. We are awaiting sign-off, depending on the case, from the relevant district attorney and or the state of New York. And we intend to begin releases as early as today once we have that sign-off, and we will continue reviewing other cases. An update on testing availability. As we said a few days ago, the health and hospital system has greatly increased its testing capacity. There are now 10 new sites at hospitals, and these sites will have the ability to serve approximately 150 people per day. 8, again, I'm going to emphasize throughout. I know we're going to get this question constantly, and we'll keep reiterating on a priority basis, on a reservation basis, until we have much, much greater testing capacity. Everything must be focused on those in greatest need, and everything will be done on a reservation basis. People who walk up or drive up without a reservation cannot be tested. We have to keep the priorities tight here. But we keep working every day to try and expand the amount of testing to reach as far as we can. The 10 sites, again, will serve 150 people per day approximately initially. Again, in every case, we'll look to increase the numbers as much as we can. 8 are already open at Bellevue, Elmhurst, Harlem, Jacoby, Kings, Lincoln, Woodhull, and Queens hospitals. 2 will open next week at Coney Island and Jacoby. There are 7 new sites at Gotham clinics. Each can serve and test 50 to 75 people per day. All will be open this week, and they include Belvis, Cumberland, East New York, Gouverneur, Morrisania, Sydenham, and Vanderbilt. 4 new testing centers. Each will serve and test 100 people per day approximately. 2 are open at Coney Island and Jacoby, 2 coming up shortly at Kings County and Queens Hospital. This is all separate from the state-operated drive-through testing center in Staten Island, and separate from the 5 new testing centers that are coming soon in coordination with FEMA that will be set up in New York City. We'll have